Coming up, we'll be on location at Grande Dental Care in Herndon, Virginia, discussing advances in dental implants and how they can help restore your dental health and your beautiful smile with one of this region's top dentists, Dr. Marcos Grande. Dr. Grande completed his residency at the Division of Maxillofacial Surgery Department at Jackson Memorial Hospital in Miami, Florida. He is a member of the American Academy of General Dentistry and the American Academy of Dental Sleep Medicine, among other organizations, and Dr. Grande is widely recognized as one of this area's leading dentists. Welcome, Dr. Grande. It's a pleasure having you back on our program.
Thank you, Rocco. It's always a pleasure being here with you.
Thank you. We have a lot more to talk about today. Last time we covered sleep apnea and all the problems related with that and how to correct it and treat it. And today we're here to discuss dental implants. And I wanted to ask you if you can please begin by telling us, for those who may not know, what dental implants are.
Absolutely, Rocco. Well, dental implants is a root form titanium piece that's is being used to restore missing teeth. Usually the tendency years ago, when you were missing a tooth, it was to do a bridge that would involve filing down good teeth adjacent to that space and having a 3-unit bridge put in, or more teeth. But in this case, if you were missing one tooth, you would have to file 2 teeth, just to get one replaced. So nowadays, with the advance of dentistry, the dental implants are the best choice as to restore missing teeth, 1, 2, or a full set of teeth. So that's basically what a dental implant is. It's a root form titanium piece that goes inside, is surgically placed inside the bone. You let it heal for 4 to 6 months, depending if it's on the upper jaw, lower jaw, and then you restore the implant with a crown.
And what types of problems do dental implants address, besides a missing tooth?
Bone reabsorption is one of those, and that's very important because usually when you lose teeth, if you don't have anything inside the bone stimulating the bone, have you ever heard, if you don't use it, you lose it?
Yes.
Exactly happen. If you're not stimulating, that bone inside the bone with the root of a tooth, okay, it starts shrinking. Shrinking and shrinking. So you're losing width and height of that bone. Imagine a patient that has no teeth and just wants a denture. Well, those patients, that intermittent flapping around the tissue can cause an overall bone loss, and eventually they lose most of the bone, to the point sometimes there is no more bone just to place implants and restore the patient. So if you lose a tooth, a few teeth, or all your teeth, usually if you can, it would be better just to consider dental implant restoration, because with dental implants you can just put a crown or do implant over dentures. You can do several treatments. Now is the standard of care, in my opinion. Even for dentures, I would recommend my patients at least to get 2 implants on the bottom, just to mechanically retain that denture, so it's not flopping around. They're going to be able to eat more comfortable. They feel more secure. The confidence goes to the roof.
And I understand there's some advances in technology recently that has taken place that allows the placement of dental implants to be done in a more efficient manner.
That's the exciting part of the profession, that everything evolves. And if you want to be on the top notch on what you're doing, you need to stick to the advancement in technology and go with the times. We use here a special software where we upload our CT scan, which is a 3-dimensional views of the patient's bone, and we can set up virtually plan the implants and see exactly where we can map the nerve, the maxillary sinus, make sure that we're not hitting any important nerve or anatomical structure. So we plan everything, and once everything's planned on the software virtually, we push a button and we send to a special lab that fabricates surgical index or surgical guides that basically have all that information in the guide, whether to put 1 implant or to put 6 or 7. And the beauty of that is, since everything has been planned ahead, I don't have to cut open a flap, and detach the tissue. So it makes the whole thing much easier and predictable and much comfortable for the patient. I have patients that have, on average, we place 2 or 3 implants on a patient probably in 40 minutes.
That's great.
Whereas before, I mean, you would have to cut open a flap, see where the bone is, watch the x-ray, you know, kind of guide yourself through the adjacent teeth. It was kind of more complicated. Because of that, you know, chances for failure were higher in the past.
Yeah.
I've been placing implants with this system over 2 years ago, and I'm telling you, the rate of success is way up. I would say 95%.
You and your practice, Grande Dental Care, have certainly established a reputation for excellence here, not only in the Herndon, Virginia area, but you have patients from throughout the region that come to you, Doctor. I just wanted to ask you, what would you say helps separate you and your practice from the others?
Well, basically, it's the convenience for the patient that they can come and get all the dental work they need in one office with the same doctor in a few appointments.
Because you offer a lot of different treatments, implants, obviously sleep apnea, porcelain veneers, whitening, general dentistry, endodontics.
Root canals, everything. Yes. So you don't have to be, you know, driving around town just looking for a specialist to get a root canal and the other one to get the teeth pulled or get in an implant. You get it all done in the same office.
Yes, indeed. And on that note, I'd like to thank you, Dr. Grande, for joining us again, being a guest on our program. It was our pleasure having you.
Thank you so much.